Good morning. This is Dr. Mia Luth. It is, I don't know, the 20th, the 21st. Oh, jeez. I guess I should have looked at that before I hit the record button, but here we go. Here's some real life. Yes, it is Friday, the August 21st, 2026. Now, I'm Dr. Mia Luth, and it is 8:35 a.m. Eastern Time, New York, USA. And since 7:30, I've already been on the phone. Here's the healthcare system in the United States of America. I tested positive for MRSA, and I had been wondering, as I mentioned to one of my other videos, like my nose hurt and there were all these bloody, crusty boogies, and then you get hard, and then I have trouble breathing through my nose. So I was mouth breathing, and my mouth gets too dry. Then I have trouble, like getting air, or I take in liquid, which is probably what caused my pneumonia at the beginning of the year. My orthopedic surgeon, apparently surgery's still on, thankfully. I really cannot handle it. If I have to reschedule it again, I'm going to get some ointment to put in my nose to stop the staph. And I have something called Herbicleanse or something that's coming to me today, which is a soap that's antimicrobial, and it's a specialty soap. So if there's any staph on my body anywhere, because you can't put it up your nose, then I can just wash for a couple days. And even though my surgery isn't, so I'll get that, and then I get a prescription strength that I use on Saturday and Sunday because my surgery's on Monday. Okay, and then I called my urologist because my urine came back and I still have an E. coli infection, which means I've had a urinary tract infection for at least 6 months, which is not good. So I called and I'm like, well, I'm not comfortable with the fact that I've had a UTI, and the reason that he didn't prescribe antibiotics in the first place is because technically I was asymptomatic. So like the general today's doctors are not as, big on just automatically giving you antibiotics. Try and let your body handle it first, right? And the fact that I was on antibiotics, excuse me, through parts of January and February of this year, probably threw all my antibiotics all out of whack, because you do have good like bacteria, and then there's not so good bacteria, and it probably wiped out all the bacteria, which allowed the E. coli to kind of take hold and sort of overpopulate. So taking antibiotics is not the standard answer nowadays. But because it's been 6 months that I've had a urinary tract infection that's E. coli, I called, and the nurse said, obviously for 6 months, symptoms are not, we want to, get you on an antibiotic. But unfortunately, the doctor is not in today. Today is Friday. So the earliest that I could be put on an antibiotic would be Monday afternoon. Yeah. So there's no prescriber in the office. And anyway, so I have ointment coming to depopulate the staff. I haven't found anything like other than in my nose, and I kept wondering. I'm like, I've had issues before with my nose and nosebleeds, usually because it's too dry, and I'm thinking, well, this is like really extra dry and extra painful, and it's because it's staph infection. Great. Anyway, so this is my life, and there's a lot I could say, but I'm just gonna. Anybody who contacted me at any point in time over Twitter and then asked for, I find many of you to just be obnoxious. Whether you are actually celebrities or not actually celebrities, it makes no difference to me, just obnoxious. Just know that. I mean, get a job. Okay, go fuck your mother, asshole, and get the fuck out of my business. And you don't know what the hell you're saying. And kiss my ass, and stay the fuck away from me. And if you aren't a medical doctor or a particularly in the know nurse, don't even try to say a single word to me. So now, with some of this, I am in October going to see a neurologist that's here close to me, because my regular neurologist is in Baltimore, and that's a little bit of travel. And considering I don't have a vehicle, it gets a little complicated trying to schedule things around such and such. I get doctors and nurses get a little pissy. Well, the doctor's only in it. We need to schedule this. And I'm just like, yes, well, I have 7 specialists or more. And I'm a human being, okay? You understand? I'm not some kind of fucking robot or some, like lifeless person who just wanders around life like a fucking zombie, okay? All this shit. And then I had to call the program nurse to let her know, okay, well, antibiotics may be coming, but I know for sure we're looking for my ointment for my staph infection in my nose, which is actually pretty painful. I mean, geez. So, I've already started, like, sanitizing my house slowly but surely and making everything as, clean as possible with disinfectant and other kind of things, so that when I do come back home from having my surgery next week, I it'll make it, a little better to know that most of this stuff's been sanitized, including my laundry. I've been using laundry sanitizer, and slowly but surely just doing that, plus kind of decolonizing any staph or other types of microbials which could cause infection, which is an issue for me in a couple of senses, because of my biologic. My immune system is not as hardy, and like I said, taking a bunch of antibiotics through January and February of this year kind of threw all my good and bad bacteria all off kilter. So no antibiotics for me for right now. A little concerning. And I got to do all this extra stuff to make sure that when I do get my surgery, I don't get an infection, because that could kill me. And like I said, I'm a slightly higher risk surgical patient. But there we go. Yay. So I don't know. It's like, yes, there's stuff I want to say, like, to some people. Right. You're right. NHL bench coach language to some. What I had to say. Like, in the United States, the way things work. Here's the other thing, is that I am on pain management. I will be on pain management for the rest of my life, and depending on the pain, because I have different sources of pain. One is osteoarthritis, the other is fibromyalgia, and some of it is also neuropathy, diabetes related. So I take Cymbalta for the fibromyalgia. I can't take gabapentin. There's a couple other pain meds I can't take. There's muscle relaxers I can't take, so I do take one. It's pretty low dose. But yeah, I am on a low dose of opioid pain medication, which in essence just basically takes the edge off. Like, when there's breakthrough pain, it's not to the point where I'm laying on the ground screaming in horrible pain. If I were allowed to have it where I am, THC gummies maybe 3 times a day, I probably wouldn't have to take the opioids, but and there's ignorance everywhere. Nurses and other people like, oh, so you get high. And I'm like, no, I have a medical marijuana card is what I have. Okay? Like, train these people better. Get in the know. Take some CEUs. Don't just assume that if somebody's got a medical marijuana, it's because they maneuvered through the system and lied to doctors to get weed so they can get high. I can't even afford it because insurance doesn't pay for it. United States of America, I've had it with your ignorance. People with non-24 and medical people and professionals and chemists and all that, listen, all I can tell you is that when I was taking a so small amount, wake and bake, small amount, and yes, smoking it is hazardous to your health. So you want to ingest it a different way, okay? Point blank. All right. Let's just say a gummy, right? And I can't remember whether it was indica or sativa, which I mixed the two up. But whichever one kind of gives you a little more focus and kind of energizes you a little bit in the morning, right before I ate, and then I eat, and then in the afternoon, right before I eat, my midday meal, like I would, if I had access, I would do like a hybrid. Okay, you just want a little bump up for maintenance. Okay, but you don't want to like totally. So hybrid work. Okay, and then in the evening, shortly before I eat, I would take the one that kind of chills you out a little and mellows you out a little, and then this bit high, not way bit high, this bit. When you're coming down from that, it starts to relax your body and you start getting a little bit tired. And So it was helping to regulate my circadian rhythm. And I'm pretty sure CBD also plays a role in that, especially when it comes to melatonin. So maybe more CBD in the evening, all right? So I'm saying for those who have non-24 and those people who need help regulating their, circadian rhythm, sleep doctors, all those, right? It's definitely worth a good look because I was taking it like a medication. Which is why over 2 summers ago, I did not refill my opioid pain meds, and I was doing that and trying to figure out what works best. So I figured that part out. Like, this is what would work best for me. So helping to assist with circadian rhythm for people who need that. So, right, non-sighted people, blind people completely, right, yes, they have something called 924. And so it's just an option that I'm putting out there. And I'm saying this medical professionals, right, researchers and people interested in sleep science and all that. That's just my experience. But where I live, I'm in a program, and some of the people in this program have had issues with illegal drugs and alcohol, and because of that, we can't have. I'm not permitted, even though I have a medical card, and even though I don't need to take opioids if I, take small amounts of THC at the proper times, and they're right. So I'm on low-dose opioids. But the opioids, so many people are paranoid. Doctors are afraid to get in trouble. Patients are being denied stuff, and because there's some who go around pretending so that they can get this and blah, blah, blah. But the ones who actually do need it have to go through every which way kind of hoop. And, it gets to the point, I know why U.S. Americans just give up and die. Politicians. American Medical Association. Very clear. I hate this term for a variety of reasons, but I'll say this. As someone who did have developmental dyslexia, and I didn't even know until I got into community college. Okay, and I went to community college. I did go to a 4-year. Okay, but family problems and my ability to handle certain things just weren't there at that time. Right. My mind was more on family situations. So anyway, blah, 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 and I worked through college, basically. So regardless, if you're going to look at someone on the spectrum, okay, so to say the autistic spectrum, I would be considered, air quote, high functioning. All right. But that doesn't mean I don't need help. That doesn't mean I don't need support. It doesn't mean, hey, look at me, I'm doing it all by myself. That's some bullshit, man. I'm very resourceful. And if I'm struggling and I'm having difficulty and I need help with this kind of stuff, so people in other countries probably can't understand what we go through in the U.S. All right, but so my pain management doc, who definitely knows how to do nerve ablations properly as opposed to my previous, definitely, that's called burning the nerves, right? Some of us have to do that on a regular basis. Pain shots. My orthopedic surgeon can do my shoulders and my knees, sometimes my feet, but can't do my hips on my back. It's like a thing, so I gotta do that at the pain management specialist. But the PA, the physician assistant, the one that I see often, just won't. Like, I had a cutoff time of 9:30 a.m. for getting prescriptions in to the pharmacy that this program uses, which is, it's basically mail order, except they deliver, right? Because it's in the same state. But it can take about 24 hours to get medication. All right. So last month I called and asked, and I said, well, my appointment is like just at the time that's the cutoff to get the medication in for the day. So is it possible for the doc to prescribe or get my prescription in, at 8:30, an hour before my appointment, to make sure that it gets in that day so that I can get it that day? All right, because the cutoff for that day is 9:30 a.m. Nope. Wouldn't even do that. Won't do telehealth. Won't do online. Some of these might be policies. Okay? They might be, singular to that practice, but they might also be state of Maryland policies. They might be federal. I don't fucking know. But you know what? Some shit needs to happen properly. And those people who aren't like me, I mean, you gotta have like a 20-person care team, and who's talking to who? I don't even know. It used to be primary care was the lead on, all of your care, you understand? And so specialists would, right? But apparently that's not always the case. And there's a difference between an MCO, which is managed care, which is in Maryland Medicaid, which is also called medical assistance. All right, yeah. Okay, terminology is, like, no, we can do way better. The medical field, constant updates and CEUs should be happening at all times. People in the United States need to understand, yes, you can't just go to the doctor anymore and ask for antibiotics. I mean, it caused problems. So they're scaling back on that. But then when I go to another doctor and I say, oh, I have a, urinary tract infection, it's E. coli, blah, 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 blah. Well, why aren't you on antibiotics? I said, well, I'm technically asymptomatic, and my urologist is not going to put me on antibiotics. Going to see if I clear it just naturally on my own. Right? Well, I mean, that's irresponsible. And I'm like, stop telling me and start talking to the doctors who are doing it. Leave the patients alone. Medical people in the United States of America have a decorum, okay, have some standards, professionalism. It's not my problem that my urologist doesn't want to give me antibiotics, because antibiotics can fuck you up and actually cause more illnesses caused by bacteria or, mostly bacteria. You don't give antibiotics for viruses. All right? Like, there is a lot of bullshit swirling around, and I am sick and tired, in the literal sense, okay? And people from other countries know you don't understand. All right? But the people inside the U.S., it's like, excuse me. Okay, when this insurance company, like my last insurance company was Medicaid, and Medicaid should have been accepted at the urgent care. But my MCO was not. And around here where I am, there's doctors just refuse to take that. So then I got to travel all the way to Baltimore. I'm like, that's some bullshit. So I had to change managed care. But then I had to wait 2 months to get a regular medication. And now I have to get all new prior authorizations. And I have to get all new, right? I had to become a new patient of a doctor that I've been seeing for years. 2. Start all over again. This unacceptable in every way. And you want me to work for a living with no family, because they're all dead. Been dead since I was 40. I didn't kill them. Can't drive anymore because I never know when I might have an issue with my neurological situation. I could accidentally, could be fine, and then accidentally my foot starts doing weird stuff because it's very similar to Parkinson's, and I accidentally slam on the brakes in the middle of I-95 traffic. Okay, so for safety reasons I don't, and I still gotta take shit from assholes, which is unacceptable. You're not the good kind of assholes. I've been needing to get a new hip for 4 years now. I haven't been cured of anything. I don't need to be cured of autism. I'm not asking to be cured. Stay the fuck away from me if that's what you're trying to do. Anybody in their right mind walking around in the United States would be depressed. I don't have an anxiety disorder. I was misdiagnosed several times. So I'm going to run out of pain meds the day before I can get to see the pain management doctor on Monday. And she won't call in a prescription ahead of time. I mean, she wouldn't even do it an hour ahead last time, so clearly not going to do it. And when I had pneumonia, quite literally, made me go into the office with pneumonia. How do you think that helps me heal in any way? Okay? Is that just the office? Is it because they're paranoid they're going to get in trouble? With who? The state? The state of Maryland? The federal government? Who? The American Medical Association? Who? So you're putting all this stress on people who need less of it, and who need help, and who ask for help, and this is what we get in the United States of America. And I gotta be honest, see, I'm military family, and I stuck by my wounded warrior, and the people in my family all worked disabled. Every last one of us did. I love driving. It didn't even bother me in traffic Because, yeah, that's my car concert time. Right? I'm like, I'm stuck in traffic. All right, well, I'm just going to listen to this CD and sing along and drink my coffee. It's Mia time. See, I'm allowed to be straight, balls out honest while sitting in the United States of America as a natural U.S. citizen. You understand? Natural born U.S. citizen. I'm allowed to do that, X.com. So you are attempting to take away the rights of U.S. citizens. And you're wrong. I want my damn account back. I don't care what other countries are doing. I don't know how many times I've had doctors like tell me, well, I mean, why would anybody do that? Oh, wait, you know, and I'm like, okay, don't be getting pissy with me and shitty with me. Go talk to the doctor who told me that. Just stop. Update your skills. Be professionals. Okay, when I go to an emergency room, I don't want to feel like I'm sitting around watching nurses and other people in high school having private conversations, talking shit about each other in front of me. Christianity care. All right, United States, everybody, get your shit together. There's no cures for what I have. So now, yes, I finally have to get a new, different neurologist here because the old one left, which is constantly happening. And then when the old one leaves, you got to get the new one and you got to go through all the other shit. And it is getting stupid. If you don't think that I pray my face off for this country, then you are dead wrong. I also have lifelong PTSD, and not as much was known when I was younger as now. Yes, people other than military and other types can get PTSD. And I share things I might not want to share out loud, like I'm doing right now, for the benefit of others. So that, you know, maybe there's some things that I do and learned along the way that can help. And so that maybe it's not a lifelong complex issue. It's just something you got to get through. I don't get paid to do this. I'm not doing this for my health. I have been online longer than a lot of the dumbasses online have been alive. I'm disabled. A lot of us have invisible disabilities. And we're in a different kind of war. I'm not going to stop, and I'm not going to shut up about it. Because I live in the United States of America. And I don't care what other country wants to try and shut me down, but not here. I'm also a scientist, so I know how to put things, especially sleep science, because that affects everything you do. Right, and so does, dentistry. So there's a lot of bacteria in the mouth. There are a lot of things that can kill you. You don't have proper. Right. All right, this is why I do it. Sleep science has been an interest of mine for a long time because I've known that I had a sleep disorder for a long time. What I didn't know was that sleep disorder was a part and pattern of something that is similar to Parkinson's disease, which is a movement disorder. I also have a movement disorder that is called functional neurological disorder, and it doesn't mean it's all in my fucking head, okay? It means, you understand, it's not structure. It's not the structures. Parkinson's nowadays, there is there's a part of the brain that seems to be affected. And so, right, now they're focusing and concentrating, there's some things that now can be done. Right. I mean, right? But it is very similar to Parkinson's, except it's just that a part of the brain that's supposed to be doing one thing is actually doing something different than it should. So it's all kind of, disordered in there. And that's not my fault. So I had dysphagia. Sometimes it's worse, but it could be because, I got ignored for quite some time until it was a huge emergency with the tooth that I could have had, right? And, it's not because I wasn't trying. It's not because I didn't do what I was supposed to do. Somebody wants to work me, I'm going to work you until you exist no more so that you can never do it to anyone else. I'm gonna be that kind of asshole.